Going on Medicare insurance is a time-sensitive decision. We don't just randomly decide to go on Medicare. We have to go on Medicare at certain times of eligibility, and we have to follow a timeline. And if we do not follow those timelines, there can be some very severe penalties. So in this video, I'm going to show you how to avoid every penalty. Now, there are a variety of Medicare penalties. The first one, though, that I want to address has to do with enrollment, meaning if we do not enroll in a Medicare when we should, there can be penalties for that. So let me explain. The majority of people that are going on Medicare are starting at 65. Now, just so you're aware, there are people that are on Medicare younger than 65, and it's because they were approved for Social Security disability payments. And they're receiving Social Security, and so what happens on the 25th month of having received those disability payments, they are automatically enrolled into Medicare A and B. And so that's why you will meet people that are 45 or 60 years old or 51 that are already on Medicare because they came through disability. All right. And so that group's automatically enrolled. But those people that are not on disability, their first time of eligibility is going to be right at 65. All right. Now, I want to be very clear as to who has to start Medicare at 65 because there's some of you that have to start. And that would be one of 5 categories. Those people that are covered right now by some kind of a retiree insurance, either their retiree plan or their spouse's retiree plan, and they're approaching 65, they have to go on Medicare at 65. That retiree plan may just get them to 65, may get them beyond, but that retiree plan, once you're eligible for Medicare, only pays second. You have to enroll in Medicare to put Medicare in the first payer position. Secondly, anyone that's covered by some type of an Affordable Care Act plan, meaning you went through the healthcare exchange to get that individual insurance. You too are going to go on Medicare at 65. Now, technically, you can actually keep an ACA plan after 65, but the problem is all the financial benefits of the ACA plan go away. You will no longer get tax subsidies. You will no longer get a reduced premium. You will no longer get cost sharing by the federal government. You will pay full premium. You will pay full cost as far as out-of-pocket cost, no cost sharing. If it has a deductible, you're going to have to meet that. So there's no reason to keep an ACA plan once you're eligible for Medicare. So again, we're starting at 65. Anyone today that's covered by Cobra insurance. Cobra insurance, sometimes people keep it for a while. Usually not. It's usually not a very good value. But if you do keep that at 65, Cobra only pays second to Medicare. And so what you have to do is enroll into Medicare at 65 to put Medicare in the first payer position. Because if you don't, what happens if you have a claim, then that Cobra insurance will only pay second and you become the first payer because you didn't enroll into Medicare. And then anyone that is retired from the military. You served our country 20, 25, 30 years in the military, and now you're retired. You have what's called TRICARE insurance. And once you're Medicare eligible, you have to enroll into Medicare A and B because now your TRICARE becomes TRICARE for life, and TRICARE for life only pays second to Medicare. And then lastly, you or your spouse are working, actively working, covered by a group plan. If that employer has 19 or less people on the payroll, then you have to enroll in Medicare A and B at 65 because that employer plan only has to pay second. And so if you don't enroll at 65 and you have some kind of a large claim, that insurance company has every right to say, no, you should have enrolled in Medicare, we'll pay, but we're only going to pay second. All right. And so again, those 5 groups of people must start at 65. Anyone that's on an ACA plan, anyone that's on a retiree plan, anyone that's on Cobra, anyone that is in a group plan that has 19 or less employees or on TRICARE, going to start at 65. And so we call that opportunity at 65 your initial enrollment period. Initial enrollment period. And that initial enrollment period lasts for 7 months. So let me just give you an example of an initial enrollment period last 7 months. Let's say that someone right now, today I'm shooting this video, it's 5/3/2023. So let's say someone is turning 65 today. What does that mean? That means that their date of birth was 5/3/1958. All right? And let's say they have to start at 65. Their initial enrollment period is 7 months. The base month would be their birth month. So that would be 5/1/2023 would be their first month of eligibility for Medicare A and B, 5/1, with their date of birth. Now keep in mind, if your birthday was on the 1st, it would actually be in April. So your birthday is on the 1st, they always move you to the previous month. But if it's on the second day thereafter, it's your birth month when you will begin your Medicare eligibility. So for our enrollment period, it lasts 7 months. And so that is 3 months before, month of, and then 3 months after. So in this example, this would be here, and this would be here, 6, 7, 8, and this would be September 1 of 2023. All right, so here's our 7 months. So if I enroll into Medicare, February, March, or April, any of these 3 months, my Medicare will start May 1st. So what I'm trying to teach you is when you enroll determines when they start your Medicare. And so I enroll 3 months before, effective date 5/1/2023. But if I enroll into Medicare my birth month, they won't start me until the next month. I'll start in June in this example. I enroll in June, they start me in July. I enroll in July, they're going to start me in August, and if I enroll in August, they'll start me in September. Okay, I can't enroll in September. That's not even an option. I could start there if I enrolled in August, but the whole point is I have 7 months to enroll. When I enroll, they're going to start me. So what happens is if I do not enroll during my initial enrollment period, when I should be enrolling, what happens is this. I've missed my enrollment period, and then what I'm going to be stuck with is an enrollment period called the general enrollment period. General enrollment period. And this enrollment period is one that we can use, but with this one comes problems and penalties. Okay, and the biggest problem is this has a very limited time in which I can enroll, and that is this. I can enroll in this one January 1 to March 31, and that's it. So that lasts 3 months of the year. And so if I miss my initial enrollment period, now I can only use this one, and I'm also going to be subject to penalties. All right, and I'll explain that here in just a minute. So a couple things I want to clarify. Let's suppose that you are turning 65 and you're on Social Security. You will be automatically enrolled into Medicare A and B, auto-enrolled. If you're on Social Security, everyone else, you got to self-enroll. And in my example right here, your Medicare card is mailed out here in January. The month right before this 7 months begin, they actually mail your Medicare card. In this example would be about January 15th, about the 25th. The Medicare A and B card is going to be mailed to you because they're going to automatically enroll you and send you the card. They use the IEP. You didn't miss anything, you're not going to be penalized. But you who have to self-enroll, we have 7 months, and if you don't enroll during that particular period of time, then you are going to have problems. You're going to be stuck with the general enrollment period. Now, I'm going to clarify one more thing. Not everyone has to start Medicare at 65, and the group that doesn't would be anyone that is working or their spouse is working, covered by a group plan that has 20 employees or more. You don't have to do anything with Medicare. You don't have to do A, you don't have to do B, you don't have to do A and B, you don't have to do anything at all with Medicare. 20 or more is the cutoff. That's considered to be a large group. Now, there are some people who are in these large group that don't have good group plans. You may want to go on Medicare at 65. You have every right to do that. But if you do have a good group plan and your spouse is covered by it, maybe your kids are covered by it, and you want to stay on it, it is fine. Now, there's some people who will decide to enroll into Medicare A only. There's usually no premium, there's no cost, but here's the consequence, though, of enrolling in A only. If you're in a large group, if you happen to have, as your insurance, a high deductible health plan that has with it an HSA, a health savings account, not a health reimbursement arrangement, not a flexible spending account, a health savings account. If you enroll into Medicare A only, you can no longer contribute to your HSA. The money that's there is your money, but no new money can go in once you've enrolled in any part of Medicare. So you got to think that through. Now, if you don't have an HSA and you're enrolled in A only, no big deal. In a group of 20 or more, your group plan pays first. Medicare A on the hospital side is going to pay second, and they may cover something. But the whole point is this group here does not have to go on Medicare. Why? Because they can come in using a special enrollment period. So what happens is, they didn't use the IEP because they didn't have to start at 65 because they qualified on a different type of plan. But when they lose that plan or they decide to retire and get off the plan, they're going to come into Medicare using an SEP, meaning the IEP is long gone. Let's say we're going to work for 2 more years. All right, so then what happens? Let's say in this example, someone did decide to go ahead and take A only. They didn't have an HSA, and their birth date was just what I talked about. So they would have an A only card that started 5/1/2023. And let's just say they work exactly 2 years beyond this. And they want to start their Medicare B, and they want that to be 5/1/2025. 2 years later, 3 years later, whatever the case may be. But they went beyond their initial enrollment period. So how do we come in using this special enrollment period? Frankly, it's quite simple, and that's this. We have 2 forms that are added to the process. This IEP can be done all online. But here now we have to have a form called an L564 and another form called the 40B. Now these 2 forms have different purposes. The L564 is given to your HR department, or whoever has employment records, and what we have to do is we have to prove to Medicare through the local Social Security office with the L564 form that you or your spouse were working actively, no gaps in coverage on the insurance, and they'll verify that on the L564 form. We have to verify all the way back to when you were 65. So if you change employers after 65, you want to make sure that you never go without coverage, no gaps in coverage, and then we'd have to have 2 employers filling out the L564. I have to have every month accounted for back to 65, and the L564 is the document that has to be given to your HR department to get that filled out. And then once we have that, then you personally, or if you work with us, we'll do it for you. The 40B form is the form that we fill out, and this just lets Medicare know when we want to start our Medicare coverage. L564 says we're eligible for the SEP, special enrollment period, no penalties, no problems. It proves that. The 40B says this is when I want to start. So let's say, back to my example, let's say I want to start my Medicare B 5/1/2025. I got the L564, my 40B, I would say please begin my Medicare May 1st, 2025. So you pick the date. And those 2 documents together, go to the local Social Security office. You can fax them in, mail them in, drop them off at the office, whatever you want to do. But this will bring you into Medicare, and you'll have no penalties and no problems whatsoever. Now keep this in mind. We would never process this paperwork until 90 days prior to when we want our Medicare to begin. Okay, if you submit it 6 months in advance, they're not going to process it. They don't want that whatsoever. About 90 days is the ideal time to get this paperwork from your HR, submit the 40B form with the L564, and then you can pick your Medicare date and start very, very seamlessly. Okay, and so if, however, I have this SEP and I don't do anything about it, in other words, I don't use the special enrollment period, I didn't use this one, I didn't use this one, which would be very, very foolish to miss this one, but sometimes people make a mistake on this, then again, I'm now stuck with the GEP. Okay, so the IEP and the SEP are the 2 that you want to use. IEP if we have to start at 65, SEP if we're going to start at a later date, as long as we do all this paperwork here and get it submitted before we want our Medicare to begin. All right, so we have penalties that come if I have to use the GEP. Let me explain next. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. All right, so that brings us then to coverage penalties. And so what this means is if you should have enrolled at IEP at 65 and you didn't, you're stuck with the GEP, right? If you kept working at 65 and came in at a later date, and this is going to be, you're 65 plus, and if you miss that one, then again, you're stuck with the GEP. All right, so let's talk about the penalties that go along with this. Here's the way it works. If I have to use the GEP, number 1, I can only enroll at a certain time of the year, and that enrollment period is January 1 through March 31st. Right? And so if I enroll in the GEP January 1, they'll start my Medicare February. If I enroll in the month of February, they'll start me in March. If I enroll in March, they're going to start me in April. Okay? And I can't roll beyond that. I just have the 3 months. As you can see, they start you the next month. So what happens? Well, I have a coverage problem because now my insurance is going to be delayed. But look at this. Let's suppose that I miss my IEP and my SEP, and I figure all this out in May of this year, 2023. I figured out, well, what happened? The GEP is now closed. So now what happens? Now I have to wait until the next year of the first quarter to enroll into Medicare. So you're going to have coverage problems. You're going to be uninsured. And so if you have any health issues, that's a huge, huge penalty. So we don't want that to happen. Now, here's also what happens. When I enroll in the GEP, here's the rules. For every 12 months that I go without Medicare when I should have had it, meaning I didn't do the IEP, I should have done it, I didn't, for every 12 months, they add a 10% penalty to my Medicare Part B. So right now, Medicare Part B is $164.90 a month. So that penalty would be what, $16.50 added to Part B. But notice this 10% penalty is for life. So when someone goes without for 3 years, they should have had it, 30% penalty for life. 5 years, 50% penalty for life. All right, and so that's the way it's going to work if we do not take Medicare at the right time. Now, I want to clarify one other thing when it comes to penalties and coverage penalties. Most people get Medicare A at 0 premium. It's called premium-free Medicare. B is not free. B has a premium this year of $164.90. And so this is based upon income. Single people below $97,000, married couples below $194 pay $164.90. If you're above those income thresholds, you pay more. That's called an IRMA. But here's my point. The penalties are attached to these premiums. So notice, if I have A at 0 premium, there's never a penalty, right? And as long as I have 40 quarters paid into Medicare taxes, which is basically 10 years worth of work, there's never going to be a penalty on Medicare A. So you don't have to worry about that. The people, though, that don't have 40 quarters, can't get it from a spouse or an ex-spouse or a deceased spouse, they actually have to buy Medicare Part A. And there's people that do that right now. If they have 0 to 29 quarters paid in, right now Part A premium is $506 a month. $506 a month. If someone has 30 to 39 quarters, the premium is $278 a month. Okay? And so those of you that have 40 quarters, that A is going to be 0 premium for life, and there's no penalties. So the people that have to pay penalties on the A are those people that have less than 40 quarters. And so here's the way that works. If I don't take A when I should have at 65, or when I retired later, if I don't take it then I have a penalty attached to this. And again, that is 10% penalty for every 12 months I go without, and they take that times double the years. Okay, so if I go without for 1 year, I get a 10% penalty added to either one of these, and I pay it for 2 years. If I go without for 2 years of A when I should have had it, it's a 20% penalty, and I pay it for 4 years. If I go without 3 years, 30% paid for 6 years. So the A penalties are very steep, but they're not lifetime like the B penalties are going to be. All right. And so the biggest issue here is not only the financial implications of missing the enrollment period, but also my coverage. Because if I make a mistake and I haven't figured that out at the right time, first quarter of the year, my coverage could be delayed for several months into the future. All right. So those are the coverage penalties. Now there's 2 other coverage penalties that people often overlook, and that would be this, and that would be for Part D plans. Part D plans. These are for your self-administered prescription medications. And so everyone should have a Part D plan unless you're a veteran that gets your meds through the VA, or TRICARE for Life. You have TRICARE for Life Insurance, or FEHB, Federal Employee Health Benefit. You can get your medications through any of those sources, and they're all credible coverage. So if I don't have FEHB, VA, or TRICARE, then you're going to get a Part D plan. Your Part D plan can either be a standalone plan, and standalone means that you chose to get a Medicare supplemental plan, or it could be a part of your Medicare Advantage plan. Okay, so we get a prescription drug plan all in one with the Medicare Advantage. But either way, I have a Part D plan. So if I do not take a Part D plan when I'm first going on Medicare, whether that's my IEP or if I keep working, I come in Medicare and SEP, I still want to enroll in a drug plan. And if you do not, there's actually 2 issues that come up. Let's say someone doesn't take any meds, they don't want to buy a drug plan, they're not concerned about that at all, and then 2 years later they want to add their drug plan. Here's the issue. When you want to add a prescription drug plan, okay, here's what they're going to do. Number 1, you can only add a drug plan October 15th through December 7th. So that's an issue. You just can't pick one up because you want to. No, you can't. And then that plan will not start until January 1 of the next year. All right, so we're limited as to when we can add a drug plan. Secondly, we have a penalty, and that penalty is 1% per month. 1% per month, which is basically about 35 cents is what that amounts to. So the penalty is not huge by any means. Right now, it's about $4.20 for every year you go without, but they add that on a monthly basis. So if my drug plan, let's say I'm on a $20 drug plan, and I got a $4.20 penalty, they're going to add that penalty, and so it's monthly. And the bad thing about that penalty is that penalty now is going to be for life. So it's 1% per month for the months that you went without a drug plan. That's 1% of the average drug plan, and they establish that every year. Like I said, it's about 35 cents right now a month. So if I go without 1 year, that's going to be $4.20 that will be added every month to my drug plan, and that's going to be for life. If I go without 2 years, that'd be $8.40 added to whatever drug plan I have, and again, I'm going to pay that for life. And so it's a very hefty penalty. But really, the biggest risk is, let's suppose that someone has no drug plan and they have cancer, and they get diagnosed in April or May of that year, and they don't have a drug plan, and the average chemotherapy, self-administered chemotherapy pills are about $7,000 a month. Well, you're going to have to pay for those full price because you don't have a drug plan. So yes, the penalties are real, but the biggest risk is you're going to go without a drug plan coverage. Yes, you can add one, but that plan is not going to kick into January 1. And so you're going to be out of pocket on all those expensive meds. And that's why it's always wise, whether you take meds or not, to get some type of a drug plan. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. Now, the last penalty I want to mention is something that most people are not aware of at all, but it's very severe. And here's the way this works. Let's say that somebody was eligible for Medicare A and B. Let's go back to my example of 5/1/2023. Okay. Now, this particular penalty and coverage penalty has to do with buying Medigap policies. Medigaps are also called Medicare supplemental plans. Those are all synonymous. And so when someone gets a Medigap policy, they're having original Medicare pay first, but because of the gaps that exist financially, their liability, they don't want to assume that liability, so they'll buy an insurance policy called a Medigap policy to cover those gaps. Most people today are getting a G plan or they're getting an N plan. G is a little bit more comprehensive coverage. N is a little cheaper, but you take on a little bit more risk. So the majority of people right now are getting a G plan. So here's my point. When you go on Medicare, and let's say we start our A and B 5/1/2023, what you can do, you have this period of time called the Medigap open enrollment period. Now, this Medigap open enrollment period is tied to your B date, the B date. And that open enrollment period lasts for 6 months. Okay? Now, here's the way it works. I can apply for a Medigap policy 6 months before I start Medicare, and then it remains open for me for another 6 months after. So I have this 12-month window, 6 months before, 6 months after, and during this period of time, what happens is there is no underwriting required whatsoever. No underwriting. So if I pick out a G plan from any carrier or an N plan from any carrier you want, that insurance company has to write you. No health questions can be asked. They're not going to ask about your medications, no underwriting. All they have to take all your pre-existing conditions. They absolutely have to write that policy. You will be approved for that regardless of your health situation. They will write it. But here's what happens, folks. After that 6-month window, in 46 of the 50 states, there's 4 states that will let you come in anytime: New York, Connecticut, Massachusetts, and Maine. But if you're not in those 4 states, all the 46, what happens after this 6-month window, you would have to qualify to get a Medigap policy. And then it may be impossible if you have bad health. So let's work it through. If someone's eligible May 1, that would be all of May, all of June, all of July, August, September, October. That means that any time after November 1 on, if they ever want to pick up a Medigap policy, they now are going to have to go through underwriting to get approved. And if there's anything going on with their health that company is not comfortable with, could be rheumatoid arthritis, it could be diabetes, it could be a variety of things that are not life or death, but serious enough where that insurance company says, no, we're not going to approve that policy. Now you got a coverage problem, because now the only policy you can get would be a Medicare Advantage plan, and now you're going to have to live with networks and pre-authorizations and all the things that go along with the Advantage plan. You just missed your wonderful opportunity to pick up that Medigap policy, and that's why I'm saying that is a coverage penalty that you do not want to incur.